So hello, PsyQ community, and welcome to today's webinar called Retail and Non-Traditional Healthcare Entering the Market. Thank you for joining us today. I am Jasmine Inman, a Managed Market Liaison with OTSCA Pharmaceutical Development and Commercialization, Inc. I'll be serving as the moderator today and presenter for today's exciting discussion featuring Monica E. Oss and Paul Duck. This program is paid for by OTSCA Pharmaceutical Development and Commercialization, Inc. and Lundbeck, LLC. Speakers are employees and/or paid consultants for OTSCA Pharmaceutical Development and Commercialization, Inc. So here we have today's objectives. First, to discuss the history and current state of retail and non-traditional healthcare. Second, to review retail and non-traditional healthcare effects on traditional healthcare. And third, to discuss how health plans are rapidly deploying retail healthcare. So the widespread fear, bereavement, isolation, and economic disruption caused by the COVID-19 pandemic exacerbated the world's strained mental health, putting additional pressures on the existing network of mental health resources. In order to better support mental health during this exceptionally difficult time in our nation's history, behavioral health providers were forced to quickly adapt many technologies that were being piloted before the pandemic, such as telehealth, digital health tools, wearables, and artificial intelligence. Detailed explanations of these issues affecting the health and human services industries are documented in OTSCA's America Pharmaceutical Inc.'s Trends in Behavioral Health Guide, 3rd edition, which is published free of charge on PsyQ. The goal with this guide is to continue to make a positive contribution to the national conversation among key stakeholders, including commercial and government payers, integrated delivery networks, and providers, about the disproportionate effect that behavioral health disorders place on Americans. While there has been much progress, there is still much work to be done to address mental health issues on a more systemic basis. This 3rd edition begins with an overview of the U.S. healthcare system, including federal policy updates, federal healthcare programs, the evolution of the Affordable Care Act, federal safety net systems, and a brief legislative outlook. The guide then moves on to look at the states, specifically Medicaid behavioral health financing and delivery models, Medicaid expansion among the states, population distribution by payer segments, Medicaid financing for people with serious mental illnesses, and behavioral health innovation initiatives. The guide then pivots to review results of a national payer survey of more than 1,100 individual health plans addressing current and future plans for behavioral health. The 3rd edition closes with an analysis of consumer access to care and delivery, including telehealth, value-based care benefit plans, integrated care coordination, social determinants of health, and managing long-term support services. Throughout the guide, the authors examine how COVID-19 has changed the behavioral health landscape, most notably the swift switch from in-person behavioral health to telehealth and the current and future impacts of serving a growing population. You can download the free full guide at psyq.org/guide-3rd-edition. From there, you can also request a free printed copy.
All right. So Monica, it's always great to present with you, and Jasmine, thank you so much for the introduction. I just want to set the framework for a moment about retail healthcare. We live in a very dynamic time, and obviously the shifts that are going on within the industry itself are plentiful. We're going to talk specifically today about one of the more critical elements of that shift, and that is the shift to retail. We saw through the COVID-19 pandemic the shift, as Jasmine said, to telehealth. But now we're continuing to see the shift towards retail. And what does that really mean to the consumer? I mean, ultimately, we all as consumers of healthcare, really, we've lived in an industry, the healthcare industry, where it's pretty much been a volume-based business. In other words, you received a service, and the practitioner got paid for that service. We're now in an evolution toward it actually mattering in the quality and the type of services also mattering in terms of the way the consumer selects that service. You know, I always like to talk about how eventually, and I started talking about this years ago, is that there'll be a shift to we'll see a price line for healthcare eventually. And we see a lot of those kind of clues going on right now where the consumer's choice for services is starting to matter even more. We're going to talk today a lot about some of the examples that are going on and some of the impacts. And I think it's important for both providers and payers to acknowledge these impacts that are going on from the standpoint of the ultimate impact to their business. And I'm privileged to be able to bring probably one of the most national experts on the topic. And Monica, I know retail, you and I have discussed this ad nauseum. Anything you'd like to add just as it relates to this this framework for retail healthcare?
Well, I think the retail phenomenon is happening, Paul, sort of, and that to parallel what you referenced, that as the healthcare system is becoming more integrated, more of pushing towards hybrid service delivery and more value-based, we have this parallel path of retail healthcare. And I think what really differentiates retail from non-retail healthcare is in one way the new organizations, the new retail organizations that are getting into healthcare and bringing a convenience spin to what they offer. So that's one part of it. The other part of retail healthcare, which is equally interesting, is the number of traditional provider organizations that, in order to maintain competitive advantage, are shifting to more consumer-centric focus in what they're doing with healthcare, developing concierge services, having same-day appointments, kind of all of those hallmarks of retail healthcare. The long and the short of it is that while traditional provider organizations and health plan execs are trying to adopt to this integrated hybrid value-based model, they're also going to have to keep consumer focus in mind if they want to be competitive. So it adds one more level of complexity to the strategy of being successful in healthcare.
Okay, so we'll begin with today's first question. So why is consumer use of retail healthcare growing, along with the number of organizations offering retail healthcare services?
So if you think about the aspect of why we purchase anything in the United States, we purchase it because we see there's value there. Just like if I were going out and buying a pair of jeans, what I value in making that purchase may be different than other people. So there are different options, obviously, both retailers, brands, et cetera. The same phenomena, I believe, is going on in the healthcare space where we have consumer choice. And as Monica pointed out, the way you access services is also changing. And you see the way payers are dynamically changing the way they reimburse for those services as well. Where, again, we've moved away from this idea of quality doesn't matter, or I shouldn't say quality doesn't matter, but more importantly is that it's not just about volume. It's not just about that I did something. It is actually about what happened as a result of this consumer's choice. Monica, anything you want to add?
Yeah, and don't you think, Paul, well, I think the retail phenomenon is parallels something that has happened in the US healthcare system for the past 15 years, and that is the amount of money that consumers are paying out of pocket continues to grow. Absolutely. So as consumers pay more out of pocket, they have more of a say in selecting what kind of services they're going to get. And I think of this as, if you roll back 15 to 20 years, only 3 to 5% of the total budget was paid for directly by consumers. That has continued to grow, where it's pushing 15% of the healthcare budget is actually paid by consumers out of pocket. So, and what do consumers want? To your example of jeans, consumers want it to be easy. They don't, they want an easy process for making an appointment. They want it easy to get service. They want to be able to essentially understand the services that they're getting and the value. So I think on the consumer side, that is really driving that change, and that's bringing in all these new organizations that have spotted this trend and say, we're going to capitalize on this trend by offering very convenient consumer services. And I think for most of the folks in our listening audience, the whole growth of all the digital first behavioral health delivery systems, the BetterHelp, Talkspace, the entire, 200-300 of them are all just one example of sort of this market looking at an underserved consumer without great service and saying, we're going to make this easier. I don't know, Paul, what do you think?
Yeah, no, I think you're absolutely right. And I'd be interested to hear what you think about the fact that the employers are obviously as concerned about this as consumers and as impacted. So as an employer, your costs have continued to rise. And sadly, the amount of benefit that individuals within your organization that have health benefits tend to get less. So from that standpoint, you have this kind of perfect storm of an economic battle going on where you have both consumers and employers somewhat aligned, and the expectations just continue to be lowered over time. And don't you think that retail healthcare is certainly going to have an impact as the price point continues to change and the consumers' quality expectations continue to rise?
Yep, I think that's a great point. And I think there's another reason why payers and health plans are not opposed to retail healthcare, and in fact are embracing it. And that is that delay in, if a consumer needs service, the delay in getting an appointment, the delay in getting the service often pushes consumers to the emergency room.
Yeah.
So, to your point, the employer, the health plan, they're saying, look, not only do we need good service, but we need good service fast, or
Yes.
we're going to end up paying more on the ER and inpatient side.
Absolutely. Very good point.